my name is Kimberly Cruz, and this is my audience. This is my mother, Patricia, and my stepdad, Don. Good evening, everyone. My name is Kimberly Cruz, and I want to talk about tonight physician-assisted suicide. Is physician-assisted suicide immoral? Should it be legal? The debate about legalizing the intention to end a life as a means to end suffering remains controversial. Some would argue that only God has the right to decide when our life should end, and that there are other alternatives to relieving pain and suffering than ending one's life. With more modern medicine comes more knowledge and skills, and with successful symptom control and supportive care, one may not be so eager for death. But for so many that have terminal illnesses, they are eager. Not so much for death, but for control over how and when they die. So who has the right to choose when we die? Should a terminally ill patient be forced to die suffering against their wishes? Some would say yes. But those being forced to suffer through their incurable disease, as well as their families, might argue that physicians have an obligation to relieve pain and suffering and to promote the dignity of dying patients in their care. That's where physician-assisted suicide comes in. What is physician-assisted suicide? It involves a doctor knowingly and intentionally providing a person with the knowledge or means, or both, required to commit suicide, including counseling about lethal doses of drugs, prescribing lethal doses of drugs, or supplying the drugs. The patient will decide if and when to take the medication, and this allows the patient to have some control and to die with dignity. Does that make the physician a murderer? Should he or she go to prison for keeping his or her medical oath and obligation to relieve their patient's pain and suffering upon their request? 45 states would say yes. They believe that the physician should go to prison. Right now, there are only 5 states that have legalized physician-assisted suicide: California, Montana, Oregon, Vermont, and Washington. Let's take a look at one particular case where physician-assisted suicide was used. Brittany Maynard was a beautiful 29-year-old newlywed from California that was diagnosed with glioblastoma multiforme, a type of brain cancer. This is Brittany here with her husband. A year after she was married, she was diagnosed with this brain cancer, and they moved to Oregon so that she could request physician-assisted suicide. She was first told that she had a lifespan of 10 years, but within a few months, the cancer had spread, and she was then given about 6 months to live. This is a photograph, a scan of a brain that has glioblastoma multiforme. The suggested treatment for this kind of cancer is aggressive radiation, which would cause severe burns to her head, and as her disease worsened, she could suffer severe headaches, nausea or vomiting, confusion, memory loss, personality changes, difficulty with balance, urinary incontinence, vision problems, speech difficulties, and seizures. She would spend her last months suffering from so many different effects from the cancer, and she didn't want to suffer or make her family suffer, watching her go through these horrific changes, all while dying. Brittany didn't want to die. She wanted to live. In a video recorded before her death explaining her decision on physician-assisted suicide, she stated, "I don't want to die. If anyone wants to hand me like a magical cure and save my life so that I can have children with my husband, I will take them up on it." But there wasn't a magical cure for Brittany, and she wasn't going to live. So rather than go through treatments that would destroy the time she had left, she chose to die on her own terms. So why should anyone other than Brittany have the right to make that decision for herself? Why shouldn't anyone with a terminal illness have the right to make a decision about their own life? When I first heard about physician-assisted suicide, I wasn't sure I agreed with it. It seemed like suicide to me, and I was always taught that suicide is not God's way. But after reading about Brittany Maynard and so many others like her, I began to realize that it isn't suicide. They were already dying. PAS just allowed them a sense of control and allowed them to die on their own terms and with dignity. Physician-assisted suicide is not immoral. It is compassion, and it should be legal in all 50 states. So let me ask you a question and give you something to think about. If you were faced with a family member in Brittany's situation, what would your belief be if that family member requested and chose PAS? I don't think anyone could truly answer that question unless faced with it. Could you just sit by and watch your family member suffer? Or would you want to see them have their request honored and die with some sense of dignity? Thank you.